So you're wondering if it's time for your kids to go into contact lenses. You have a few questions. I'm going to answer them. Stick around. So you're wondering what the best contact lenses are for kids. You have a few questions. Let's get at it. Before we do, I'm Joel Hayden. I am an optometrist in Mansfield, Massachusetts, and welcome to the EyeCare and Wellness channel, where I'm an optometrist and nutritionist talking about all things eye care and wellness. So, let's talk about the best contact lenses for kids. I've been fitting contact lenses for children for about 25 years. I've seen a lot of things, and I thought I would share with you some good pointers on how to really determine whether your kids are good candidates or not, and then go into what the best contact lens that I think your children should go into. How old should my child be when they consider going into contacts? And this can be tough because we fit contact lenses for pretty much any age, including infants. I usually don't fit infants. I will usually send them off to a pediatric specialist at that point. But I usually go 11 is usually my over-under. But I have a lot of kids motivated under 11 years old for many different reasons, and I've fit 7-year-olds up very often. Again, we need the right scenario. Your doctor is going to help you with that, but I'm going to help you with some simple questions. So if your child's really active and they have a heavy prescription, it can be really tough. It can be clunky. Things like baseball. One of the hardest things to do in sports visually is hit the baseball. And they really should be seeing well. Contacts are a great option for them at that point. Another one is something like gymnastics, where they're tumbling and they're doing so many things, and wearing glasses or even a pair of sports goggles is really difficult to do. That's another place where it can really help to have the contact lenses. Maybe your child has a lot of environmental allergies, and you would think that the contact lenses may not be the best option, but going into a daily contact lens where you throw the contact lens out every single day can be a big help. I always tell the parents to start slow. Pick those times where you really think they're going to be advantageous to have them in the contacts. Try to make it on a regular basis, but don't push into full-time wear until the kids are really ready for it and want to themselves. I also really want the child to be motivated for contacts. I want the child more motivated than the parent, because I can't tell you how many failures I've seen come in my office where the parent is nearly insisting that the child goes into contacts and the child wants nothing to do with it. The child's going to win. The child is not going to go into contact lenses if they're not motivated to. So please, please, please don't push your kids into it. You're setting them up for failure. It's very difficult. It's hard enough to be able to fit a motivated child into contact lenses, but an unmotivated child just is you're setting yourself up for failure as well, because maybe if you'd hold off 2-3 years down the road, the child will open up and say, I really want to get into contacts. But if you give them a bad experience first, it's over. And I've seen pushy parents do this. And they want their child to be better in sports, so they have a pretty heavy prescription. We're going to put them in contacts. We're going to get them seeing better, and then they're going to be better in sports. Stop. Really, really make sure that child is ready. So again, I would lean on your eye doctor a lot, but these are some really good questions to go over. How old? How often should we expect to have them wearing contacts? These are what my concerns are, and your doctor will be wonderful at telling you. Almost every optometrist out there on a regular basis fits kids, and that should really help in getting you to the point at figuring out the when and the how. So let's get into what the best contact lenses for kids are. For me, it's a no-brainer. I fit contacts for so long that once we started fitting daily disposables, and for anybody who doesn't understand that, they're soft lenses, but the patient puts them in the morning, takes them out at the end of the day, and throws them out. So every single time they wear a new pair of contacts, they're fresh, they're brand new. And it makes them more comfortable, it makes it a lot easier. And imagine you have a son who's playing Little League, and he's sliding into second base 3 times a week in contact lenses, getting dirt in his eyes. You don't want him trying to clean those as best he can and putting them back in. Again, that's a problem. Or you have a daughter who's doing gymnastics and she's tumbling a lot. In the middle of one of her competitions, a contact lens pops out and you can't find it. Well, it's no big deal. You're going to carry probably 3 or 4 extras with you anyways. Just pull out a new one, tell her to go put it in. All's good. Cost is pretty low. So those are the reasons why I think contact lenses can work so well for these kids. As to the best daily contact lens, because now I've told you that I want your kids in daily contacts, which makes so much sense. The best daily contacts for children, I believe, is the Alcon Daily Aqua Comfort Plus. And it's a very good lens. It's a stable lens. It's a comfortable lens. And it's not a very expensive lens. So if your child is losing them more often, it doesn't matter. You know, it's not a big deal. Let's say they're only going to wear them to baseball practice and they're only going to wear them for 3 hours. You're going to know they're going to be comfortable, they're going to fit well, they're going to see well, and they're going to throw them out when they're done. So any other questions, please put them in the comments down below. I hope you liked what I had to say. I hope this was helpful. And until next time, take care.